Cynthia V. Acubi.
Go ahead, please proceed, Kathy, with the roll call. Did we lose Kathy, John?
She's just come back on. Her
Okay.
audio is connecting right now. I think she must have just dropped off.
And while we're waiting for her to reconnect, for the record, Presiding Judge Lamarena and I are present. Okay, let me do that again because the meeting is just, the recording is just initiated and the live streaming. And so for the record, I am Chief Justice Philip Carbolito and Presiding Judge Alberto Lamarena are present, and we acknowledge our presence for purposes of roll call in the meeting. And so, Kathy, if you could proceed, continue with completing the roll call.
Trustee Donna Muñoz-Canata.
She is excused. She is off island.
Guam Bar President Jackie Terlahi.
Today, I am present, calling in from Agana.
And Your Honor, I know that Attorney Cynthia V. Acubi said she will be on the meeting, so she's just running a bit late.
All right. So I want to acknowledge that we do have a quorum and we are able to transact the business of the board before us this afternoon. I also, for the record, we have the proof of due notice of the meeting in accordance with the open government law. And I have determined that we have a quorum and that we can proceed. The first item on the business is the approval of minutes of the regularly scheduled meeting of July 27th, 2021. Is there a motion to adopt?
So move, Mrs. Chairman.
And Attorney Terlahi?
Seconded.
It's been seconded. It's been moved and seconded. Any discussion? There being none. All those in favor, please say aye.
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 Those opposed, the ayes have it, and the minutes are duly adopted. Before we proceed with the transaction of the old business, I just want to acknowledge the presence of certain guests that have logged on to our monthly meeting. And I see that Senator Amanda Shelton is with us this afternoon. Good afternoon, Senator. President of the Mayor's Council, Mayor Jesse Alec, and Ms. Lou Sanchez. Congratulations, Lou. Understand that you're now an advisory member of the Elder Justice Center, and Kathy Campbell, who is all the way from California logging on. Thank you, Kathy, for your interest and your assistance. And any other guests that I may have missed, please, I acknowledge your presence. Thank you for logging on and indicating your interest in the topic that is going to come up before the board. How I would like to proceed, because there's been a request. Donna Muñoz-Canata is currently traveling on business, and she has asked that before there is any official action on the extension of the Elder Justice Law Center requests that is before the trustees, that she be allowed to be present for that meeting. So while we may start the discussion and entertain the presentation of management, I would like to dispense with any action in reference to this item until the September board meeting. As part of that, we are needing to act on a motion to extend the pilot program to the end of September, so there aren't any issues with certifying funds for our certifying officer. Also, the presiding judge has a jury to select at 1 p.m., so he cannot be with us past that time period. On all the more reason why I'd like to extend any action on the extension of the Elder Law Center until our September board meeting. And so is there any objection to that request to modify the agenda?
No objection.
Okay.
No objection.
All right, so the first item under old business is the financial status update. And I will recognize Mr. Mike Moreno.
Thank you, Your Honor. Can everybody hear me?
Yes.
Yes.
Yes. Thank you. Thank you, Your Honor. And good afternoon, PJ and members of the board. We have just received our second allotment for August on August 19th, 2021. And with that, we are at 97%. We are expecting 3 more allotment releases by September end to complete the appropriations for APD and for PDSC for the fiscal year of 2021. Moving on to the domestic violence program, we are still pending the MOU, the signed MOU and authorization from BBMR for Stop 20. However, we are invoicing all services except for the sexual assaults to ICJR funding. And as a side note for the EJC, presently we have just issued the July invoice, and as of July 31st, we are still pending receivables of 44,000. That is all for the financial reports.
Thank you, Mr. Moreno. Any questions for Mr. Moreno on the financial report? We are glad to hear that the allotments continue to be released on time and
Yes, it is on time, sir.
and are on track. Thank you, Mike.
You are
So
welcome.
and I would like to acknowledge for the record the presence of Trustee Cynthia Ekubi. Thank you, QB, for joining us. And so the next item is a report from our Public Defender Service Corporation Executive Director and Mr. Steve Hattori. Steve, you are recognized.
Good morning, Chief Justice. Sorry I'm late. I came from the dentist where a simple root canal turned into a extraction of a molar. So my face is swollen and I'm drooling. So I'll just leave my mask on. Anyways, we have we attached a BJA presentation, but we're gonna ask to table it because I feel we have more important things to discuss with the Elder Justice Center that may take up a lot of time. We have implemented some new policies. We are good, like the judiciary, we are gonna require mandatory vaccination. We've been informed that the Department of Corrections is also gonna impose a mandatory vaccination on all visitors. And we're proceeding with that grant to set up video conferencing so that we can have Zoom meetings with our clients there. We've also fixed the problem with attorney-client calls. There was a bill that was passed recently. Thank you, Senator Shelton, since you're here, that allows all our indigent clients to call their attorneys for free. And the beautiful thing about it is it's funded with other the profits from other paid calls. So the inmates are paying for the inmates calls to their attorneys. So we're really happy about that. We were having difficulty meeting our clients over the phone, and with the rise of cases, we feel that it's just a matter of time before we're doing most of our interviews over the phone or hopefully through Zoom. But I'll leave everything else for the next meeting, Mr. Chairman.
All right, Mr. Hattori, and we sympathize with your root canal, but you are coming through loud and clear. But
Okay, thank you.
There being no objection, we'll go ahead and defer any further report from our executive director until the next meeting. And so we'll just move down to our APD managing attorney, Annie Marie Gell. Annie, you are recognized.
Thank you, Your Honor. I'll just defer everything until September, Your Honor. I know we're under a time crunch, so nothing new to report. We can just wait till September. Thank you.
All right. Is there any objection to Annie's request that it just be deferred until the next meeting, her report.
No objection,
No.
Your Honor.
All right, there being none, in reference to the report from the Elder Justice Center, like I mentioned, I want to consolidate that with under new business. I think, I don't know, Kathy, Kat Seguenza, if you were on before I announced that we're going to go ahead and proceed with the presentation, but defer any action item until the September board meeting, only because there's been a request by Trustee Donna Muñoz-Canata to be present before any decision is made regarding extending or making permanent the pilot program. However, we do have to entertain a motion to extend the pilot program until the end of September to allow us to do that. And with that, and one more item so that in case we drop off because of this weather that's around us and it may affect the power, is in reference to the BJA Sixth Amendment Initiative. This was supposed to be a report on the part of management from the cumulative discussions we've had in the past on this topic. And so if there's no objection, we will put that off again until the September meeting. It's really for information purposes. And so it doesn't hold up any action on the part of our lawyers in reference to following up and implementing the initiative. So with that, unless I'm told otherwise, I will recognize Kathy Seguenza for her to make a presentation. And before you do that, let me just summarize this item that is before us. As people on this virtual meeting are aware, we have initiated a pilot program under the Elder Justice Center. It's a 6-month program that is funded by federal funds. And that pilot program is supposed to expire on September 15th, 2021. And what we have before us is a review as to whether or not that program is going to continue and in what capacity. And as many of you have seen from the agenda, it has received tremendous support from our leaders in the community and some of who are present before us. So I acknowledge the written letters that have been submitted, resolutions from Senator Amanda Shelton, from the various mayors who are represented, and the lead person, the president of the Mayor's Council, Mayor Jesse Alec of PD, is present. And so those writings are part of the record. They've been submitted. I have reviewed them, and unless there is a request for anyone to summarize any statements, I will accept them into the record. And at this time, I would just like to acknowledge Ms. Kathy Seguenza for her to begin in reference to giving us a status of the Elder Justice Center and its performance and who has reached to help, and just what are the plans and what is it that the management would like the board to consider. And so at this time, Kat, I will turn it over to you.
Your Honor, can you see me?
Yes, I can.
Okay, all right. Thank you, Mr. Chief Justice, board members, and guests. For those who I haven't met, as the Justice said, my name is Kat Seguenza, and I was asked to manage a 6-month pilot program to offer limited civil legal services to our senior citizens. It's referred to the Elder Justice Center and sometimes referred to as the EJC. I think we've succeeded in fulfilling the purpose of the trial period. We've got a very good handle on the demand, which is very high, and the resources needed to meet that demand. We're here today to present a proposal to extend the pilot program beyond its original 6-month period. Next slide, please. Originally, there was a resolution which later had to be amended, and in the end, the opening, the 6-month period would start after the opening. That was the soft opening that began on March 15th, which means that the pilot program ends on September 15th. So we'll have to consider that, Your Honor, to make sure we're covered. Next slide, please. The original wait list we began with included 357 services. Through our outreach and activities in just 4 months, we increased it by 50% to 547 cases. One of the supporters put it this way: in her experience in financial institutions, she has seen senior citizens who are in desperate need of legal advice on how to manage and distribute their personal assets to their family. Thus, I think without a question, the pilot program has clearly established that there's a need for this service. Next slide. We also have the support. In fact, the support that we've received is heartening. The outpouring of support from the community is astounding. We started to have clients to fill out surveys, and so far they've all been positive. Next slide. We are required to establish an advisory council. We have a distinguished panel to comprise the advisory council who have all committed to serve if the program is extended. Judge Sokola needs no introduction. For nearly 2 years, 2 decades, she served as judge on the Superior Court of Guam, and we're all familiar with her accomplishments. What you might not know about Judge Sokola is in her early years as a lawyer, she worked at the public defenders. And she smiled as she reminisced and told Kat Leon Guerrero and me about her work in the civil department of the public defenders. In those days, she said, we did everything: wills, contracts, divorce, bankruptcy, you name it. So we are so honored and privileged that she has committed to serving now. We know that in her heart, she shares the same desire as we do, and that is to help the vulnerable senior citizen population. Thank you so much, Judge Sokola. Next slide. And many of you know Mayor Jesse Allig is the mayor of Petey, and as Justice stated, he is also serves as the president of the Mayor's Council. We were very fortunate and were invited to the last Mayor's Council monthly meeting in August. Following the presentation, Mayor Allig was the first one to raise his hand and state that he would support the EJC both as president of the council and on his own individually as a member of the community. We know that the mayors are busy. Sometimes I think that they're the busiest employees in Guam. So we're very thankful that he's taken the time to accept our offer. On behalf of the Mayor's Council and in his capacity as president of the council, he presented Chief Justice Carbolito as in his capacity as chairman of the Board of Trustees, a resolution. The resolution is in your packet, and it's introduced by 26 individuals. It was transferred to the governor, the speaker, and Senator Shelton. It provides that the council unequivocally supports the partnership between the public defender and the Department of Public Health to administer legal services. Next slide. No matter who I ask on Guam, if they know Kathy Long, except for one person who said she was my classmate, everyone else responded the same way. I've heard of her. She's been practicing in California for 35 years. She's an expert in elder law, and she founded Elder Solutions in Los Angeles. As a Guam daughter, I can tell you her heart is still in Guam. She's actually been a panelist for the judiciary, as well as other programs, I think, at UNH. Not only has she committed to serving on our advisory council, but she's offered to be a sounding board to offer advice if we need to talk through a problem. She's also sending us books and informational material on elder law so we can start our own library. Next slide. Neither does Lou Sanchez need an introduction. We are all familiar with her contributions to our community, and we are proud to have her join the advisory council. Lou recently retired from the First Hawaiian Bank, and her experience in the banking industry will be extremely helpful. With her help, we can run educational programs and teach bankers how to recognize and prevent fraud abuse of our seniors. Unfortunately, it occurs all too often on Guam, but we are thrilled to have Lou and thank her for her willingness to participate. Next slide. Oh, Dr. Lee. Dr. Lee is a gem. She found us. She's a primary care physician born and raised on Guam. She's a member of the Advisory Council for the American Cancer Society. She also oversees a grant in the GWEP program at the University of Guam. GWEP stands for Geriatrics Workforce Enhancement Program. Its primary goal is to transform the current healthcare system to help the elderly and Alzheimer's patients. She's offered to collaborate with us and do advanced care planning training sessions for our seniors. Her program at the university is in its 3rd year out of 5, and it's a legacy grant. So that means it can be extended. And it's part of a much larger grant, about $750,000 grant. So we're happy to have her. Next slide. We have 2 alternates, council members. It's Mr. Tom Devlin, advocate for our veterans, and the Honorable Paul McDonald, mayor of Agana. Next slide, please. I don't have to go over this slide because Justice Carbolito explained the extent of the endorsement letters that we've received from the various mayors. At least for the board members, I hope you have a chance to read them. And I understand there are more letters arriving, but they didn't make it in time for the packet to be distributed. So we will follow up and turn over whatever we receive. Next slide. We had to put this one in because one of the clients in their questionnaire said, "So happy about the services. Hope someday we'll expand more services." So we'll see. Next slide. And while we're on the topic of support, we'd like to thank Senator Art San Augustin he's the director of the Department of Public Health and Social Services, whose tenacity to get this program underway has been undying. I hope, Director, I hope that we can continue our partnership. Next slide. As part of the pre-screening process, we addressed 547 cases in 4 months. That includes attempts to contact all 356 people on waitlist 1. While we were doing that, another 191 cases came through the door from our referrals and outreach. Next slide. From all those files, what we started to notice was there were clients on that wait list who no longer needed services. They had passed away or relocated or could not be found, or they had requested services beyond our scope of our work. When that happened, we made referrals to the Guam Bar, Guam Legal, Micronesian Legal, Office of Public Guardian, and other relevant places. So what's left? Next slide. 266 cases, and that's the number of cases we opened. Because we are client-centered, intake is very important. The intake process involves establishing a rapport with the senior and gaining their trust. It's conducted by one of our advocates who is compassionate and patient with the senior. It's during this step that the advocate might think of other services that would be helpful to the senior, like food nutritional services, transportation, adult protective services. Next slide. What's important to recognize in this slide is that the majority of our work during the first part of the program concentrated on the first part of the process, the calls, the intake. And once the files were open, we had to start from scratch. For all of these processes, we had to develop operating procedures, create template forms, make calls to locate clients, do the intakes. At the end of the day, it ended up with opening 266 cases, and I think that's pretty good. Once we finished the legal work, the case is closed. Now you see a small number there, only 37 closed, and that's because, as I said, we were concentrating on the first part of the process. I think what you're going to see in August and September is you're going to see that closed case number grow rapidly. Next slide. Okay, here's a chart that gives us a breakdown. What I did is separated what did we do with the waitlist 1 people, and then what did we do with the new emergency people? And we had to establish a triage. So if we got an emergency call, the person on the wait list was bumped. And what you can see is we did the 356 cases from waitlist 1. And as I said, 191 new ones came in the door. And after all of the processes were completed, we ended up with a total of 229 open cases. Next slide. During one of our meetings, Chief Justice Carbolito suggested that we apply for the American Rescue Plan, so we pursued that. The administration didn't give us a whole lot of guidance. Basically, they said, write a wish list, so we did. And the resources listed in this little chart is our wish list. We coincidentally, around the same time, the chair of the Senior Citizens Committee, Senator Amanda Shelton, asked us what it would cost to operate the EJC properly. We had all the information because we had just done it, and we revised it a bit and sent it to her and considered it an unofficial breakdown of the costs. It's showed in the next slide. The total amount, after including personnel, lease space, having a vehicle, supplies, and miscellaneous, came to $772,234, So what we have to do is we have to subtract the grant because we get $192,144 from the feds, and the difference is around $500,000. As it turns out, there's no local funding available from the legislature. The likelihood of obtaining funding from the American Rescue Plan is unknown. So what we're left with in reality is the $192,144 to do everything that I just talked about. It's obvious that we're going to have to change. Our services will need to be modified. We are willing and committed to work out the details of these modifications with public health, and we hope that they are receptive. It's doable, but we have to just change things a bit. Next slide. I wanted to end on a positive note and let you know that when the funding is available, we'd like to hold legal clinics at the senior citizen centers and church halls after Mass once the COVID restrictions are lifted. We've identified gaps in services and would love to work with the Guam Legal Services, Office of the Public Guardian, and basically those two to figure out who will handle what kind of guardianships, because a few are falling through the cracks there. We'd love to continue our cooperative activities with GWEP. That's a little gold mine for us, I think, and we're on the same wavelength as Dr. Lee. So holding those training sessions, we too will learn more about dementia, and that comes into play because when is a patient with Alzheimer's competent to sign a document? So we're going to learn about that. But we need to be realistic. And realistically, we have a budget of $192,144. Our services need to be cut. So thank you for your consideration. And I hope that we can figure this out because it's a worthy project. Thank you.
Thank you, Kat. And before I ask my colleagues if they have any questions, if you would just permit me, and as the chair, to make just a few statements. First of all, I want to commend you, Kat, for bringing the Elder Justice Center where it's at, even where it's at today, just with under our pilot program. And I want to commend you for recruiting such a prestigious and reputable advisory council members. I think our whole community will be well served in people that you have contacted and have agreed to volunteer their time for this very important project. And I think I am speaking in part for my colleagues on the board. It's never been about whether or not this is a worthwhile program. Everyone agrees that providing service to our elder population is something that we all support. We wish that we can deliver the service in terms of what is demanded, warranted, and well-deserved. However, it's always come down to resources. When we started this, it was made very clear that the Public Defender Service Corporation, first and foremost, provides criminal indigent defense as mandated by statute with the limited resources. And as you all aware, we have our challenges even with meeting those requirements. And so now speaking for myself and wanting to see this continue, finances continue to be the priority in reference to how this gets funded, especially when we're comparing 192,000 to 777,000 to do this right. And so and if we are going to be limited in the funding and continue this service, then we need to map out the scenarios and what is it that we can afford with 192,000, and how do we accomplish the programs with the resources that correspondingly are limited with that level of funding. And as we continue to explore other areas in obtaining funding, and I'm glad that Senator Amanda Shelton is here and is aware in terms of the interests, the desire, but the limitations that we have as trustees on this board to accomplish the policy objectives of establishing this Elder Justice Center. And so just with those preliminary comments, I'd like to open it up to the floor to see if any of the trustees have any questions for Ms. Seguenza. and any comments, and would like to take advantage of some of our leaders that are here, policymakers, and in terms of what type of assistance we can hope to obtain from outside the Public Defender Service Corporation. So with that, presiding judge, I'd like to give you the floor since you have a limited time to be with us.
He's mute.
PJ, you're muted.
Thank you. Yeah, I understand. Thank you. Thank you, Chief Justice, for giving me the opportunity to speak. Excellent presentation, Kathy. I appreciated it. It was well prepared. And I like the selection of the advisory board. I think all of them are leaders of the community. They have the commitment to make sure that our senior citizens properly get the proper legal advice that they need. And that these people, then the board members are also dedicated to make sure that services are always constantly provided to our elderly, our senior citizens. I like to also, in your presentation, one of my concerns was I wanted to make sure that we covered all aspects of our community, not only certain segments, but on outreach. So I just like to know on the 500 and some people that were referred to you, how were they referred to you to the center?
Thank you, Your Honor. The 357 were on waitlist 1. The 191 are the ones that came in, and it's across. We've ever since you brought that up early on, we've been tracking ethnicity, and mostly Chamorro and Filipino. I want to open the senior centers because right now I think we're getting most of our clients from the Department of Public Health. Usually their CMS division is the one that's sending their clients over.
Okay, so they're usually referred by public health then?
More often than not, and we will have a number for you at some point because we started tracking that.
Because I saw that one of the members is Mayor Alec, and that the mayors are the as they say, the first responders out in the villages. And if there are any questions by anyone, their first thing they go to is the mayor. And so I like to make sure that the mayors are informed about these services, so that if any of their constituents need these services, the mayors can refer them to you. I'd like to. The second part is, what type of services do you provide? Do you wills, guardianships? What type?
We're limited. First, I have to tell you this. The goal is, once these COVID restrictions are lifted, to go to those senior citizen centers and have the presentation, and right then and there have the laptop and the printer and be able to get the document done and have the client leave right away with, say, a power of attorney in hand. We're limited to the restrictions that the board placed on us. We only do wills, basically simple wills, powers of attorney, living wills, and guardianships.
Okay.
And frankly, the guardianships, there are gaps in the guardianship. So we've got to sit together with OPG and Dan and make sure everyone. The biggest problem is grandchildren. The grandparent comes and wants to have guardianship over the grandchild, and the mother's nowhere. They don't know where she is. So those are the kind of things we should be able to help them with that. So we'll get our heads together on that.
Okay, thank you very much.
Yeah, thank you.
CJ, I think you're moot.
Okay, I'm going to ask our president of the Guam Bar, Jackie Terlahi. Do you have any comments or questions, Kathy? that you would like to extend?
Kathy, I think the work you guys are doing is fantastic. And obviously there are lots of gaps. I mean, kind of my heart kind of dropped when I saw the proposed budget and the actual funding, because I thought it's too huge a gap. So how do we address it, right? And I think the idea of the co-working between the Office of the Public Guardian, the Guam Legal Services, the Elder Justice Service, I think that that's fantastic, trying to fill that gap. And so, I don't know, I thought I'd ask your thoughts about what you thought on a triage process on your client intake, so that we can start to filter out maybe those kinds of clients that you foresee cannot be served by any of those bodies. And then how you would propose that we get the services to our Manumco, despite the fact that those arms that you mentioned are not going to be able to do that. So I'd like to hear your thoughts on that.
Thank you, Jackie. We send them to the Guam bar. That's what, if they don't meet, if they don't qualify for us and they don't qualify for one of the services that you mentioned, they go to the Guam bar referral. And I think this would be a great time. We're working with other people, but maybe we could work together and get that lawyer referral list, updated with people that want to do this kind of work. That would be helpful.
And that was going to kind of my thought, right? Because I thought, darn it, Kathy, are you throwing this back on my lap? Because the list comes to my office, right? So what happens is if you tell them that you can't help them, they call the Guam bar, and then my office is what answers the Guam bar, right? So, and I thought maybe you could consider whether or not we could augment, I don't know, training or certification almost, but not really, for attorneys interested in this area, to consider that, that maybe before getting on this list, that there's got to be something besides just a list, because we've got many lists, right? And so the problem though I still see is for our Manumco. I mean, can I tell you how many Manumco I have come, right, for services here at my office? And then they ask me, Attorney Terlahi, how much do I owe you? And I tell them, Saina, pay what you can. And, it always breaks my heart, right, that to take any money from my Manumco, but at the same time, right, their concept of the legal services, of how much legal services cost and the actual costs are so far apart. And so kind of, I would like kind of our Elderly Justice Center to think about that in terms of trying to match, at least bring it a little bit closer, to educate our Manumco about the cost, because in the end, even if you send them here to the list that we develop, we provide services for our attorneys as well to educate. My concern is that our Manumco still will be left without service, because then we've got many who are very land rich, but not money rich, right? So, and I don't want, as you said, I don't want our Manumco taken advantage of either. So I think your ideas of working together to try to figure out a solution is great. And, I don't know, I'm open to a suggestion about how to get some of our attorneys involved as well in the development of a program that would be kind of a cooperative between all the entities.
Yeah, great. Yeah.
So call me. Thanks, Kathy.
No, thank you. Thank you, Jackie. I think we're on the same wavelength, and I've always thought that. Remember, it's this board that limited our services. And we did that for a reason. I'm happy we did that because it's giving us an opportunity to get the wheels in motion. One of the things over time, and I'm not saying today or next week, but one of the things may be that the scope of our services could increase. That would help. Thanks.
Thank you. Thank you, Jackie. Attorney Akivi, do you have any comments, questions you have?
Thank you, CJ. And just wanted to congratulate you, Kathy. I know you and your team have worked very, very hard. And so we look forward to seeing how we can move this forward to benefit the community. Only one comment I would suggest, as President Chalahi pointed out, as well as CJ and PJ, is perhaps in working together, maybe the elder justice system could also look to areas such as maybe the University of Guam or Guam Community College. They may have programs or grants there that might help. Or I've seen that interns or people moving into, let's say, into the nursing or medical field that could help educate, as President Terlahi pointed out. There may be resources that they can tap on, or services of individuals that are going into a program that can help benefit as a volunteer, but yet receive credit for either their thesis or their courses. So something there to look to that kind of would make it a collaborative, not just a triage, but certainly a collaborative effort of the entire community. But congratulations and good job on the work that you've done thus far with you and your team. Thank you. Thank you, CJ.
Thank you, Attorney Akivi. So I'd like to extend to Senator Amanda Shelton if she has any thoughts as largely the success of this program in a long-term viability and increasing the scope as dependent on the resources that it receives. And so do you have any thoughts in reference to how that can be obtained, Senator Shelton?
Thank you very much, and thank you for the presentation. Kathy, I appreciate it a lot. I'm so happy to see the success of the Elder Justice Center, and of course, my colleagues here in the legislature are also excited. When I spoke with Kathy a few days ago about the needs of the center and how quickly it's grown, the demand we've seen, I think everyone was very surprised to see that and to see that kind of budget breakdown. And as you know, we're in the middle of budget discussions right now, and I've brought that to the budget chair to see if there's any way possible we can get a little more funding for the public defenders, and to see the Elder Justice Center have the resources it needs to get through this long wait list. We have not been able to find anything yet. You know that we are very tight. This is a very lean budget, and we are faced with tough economic times ahead. But I'm glad to hear, Kathy, that you did go to the administration to ask for the ARP funds. That was one of my thoughts as well, one of my suggestions. I'm happy to see that. I will also encourage them to do that. And I will definitely work in the next budget cycle, if we're not successful in this one, to find any funding source to ensure that in the FY 2023 that we really plan ahead for this to see the appropriate resources go to the Elder Justice Center.
Thank you, Senator Shelton. And
Very much.
Kathy, in reference to the federal funds, what is the outlook and any discussions with public health? I know Charlene's here. In reference to the continued level of funding that it currently receives, or can we anticipate that at least that level of funding will continue for another fiscal year, the $192,000?
Your Honor, that's my understanding. It would last for 3 years, but Charlene, if she wants to pipe in here, she knows better than I.
Please, Charlene.
Okay, on the aging side, we do anticipate our minimum maintenance of effort, that's the federal to the local match. As Senator Shelton has brought up, we are currently in the ongoing budget cycle for FY 2022. A bulk of this funding for 3B supportive services, the legal assistance service project that we have is on the local end. We do anticipate that we will continue to get support to continue at the current levels that Kat has brought up of the 192, 144. Amongst the legal assistance, we hope that we will have support for the other 5 supportive services, since I have this area. So legal is one of the 6 supportive services that we have, through the division, through our state plan, to have services to engage our seniors to age in their community. So we are very appreciative of Senator Shelton and efforts, of course, with our director, San Augustine, who I know would like to be here. I understand he's out at the schools doing monitoring, so he was made aware. So bringing that up because of the spikes that have been happening. But yes, that's our intent, is the level of funding that's been identified of the 192, 144 for FY 2023, FY 2022.
Thank you, Charlene. So with that, my thinking and position, Kat, is that you prepare for the September board meeting, the plan of action in reference to continuing the Elder Justice Center at the funding level of 192,000. I think that is seems to be, based on current discussion, the most realistic level of funding going forward. And what is it that can be accomplished, and what are the goals that the Elder Justice Center hopes to achieve with that level of funding? And so then we can put up as an action item in the September board meeting the continuing the Elder Justice Center program with that level of funding, should that continue to be the case. And so before I entertain a motion, before the presiding judge leaves, if we can continue the pilot program through September 30th, which will allow us to bring this back to the board in our September trustees meeting, that hopefully we'll have all members present who can then provide their comments, and then we can decide how we are going to proceed with the Elder Justice Center. And so are there any other comments or questions, Kat, that you would like to make before I entertain a motion to extend the pilot program through September 30th, 2021?
Nothing, Your Honor, except to truly thank everyone. And everyone, keep your ears open. If you hear of anything, let me know. That's it. Thanks.
All right. And so at this time, PJ, I'd like to entertain a motion to extend the Elder Justice Center pilot program through September 30, 2021. Is there a motion to that effect?
Yes,
Your
Mr.
Honor,
Chairman,
ahead.
I'll make the motion.
All right.
And I'll second it, Your Honor.
Okay, it's been moved and seconded. Any further discussion? There being none, all those in favor of the motion, please say aye.
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 All right, it's unanimous with the 4 board members present, and so the motion is duly adopted. Now, we still have some time before we adjourn, and I'd like to give the opportunity to extend to the floor any of our advisory council members if they wish to make any comments for the board's consideration and that you would like to extend. Any other members? Okay, there being none. Kathy Campbell, do I see you wanting? But you're muted. Kathy, you're muted.
What's the question, Your Honor? I didn't hear.
Kathy? No, Kathy Campbell.
Okay.
Am I muted still?
No, I can hear you now.
Okay. I just wanted to tell you thank you for the opportunity and to encourage everyone to think really hard and really deep for collaborative opportunities. Perhaps consider reaching out to the private sector because this is an area of the law that is growing very quickly as the population ages, and also an area where there is just very limited time to make effective action because of the nature of the clientele. So I think that, everybody seems to be very committed to trying to find a solution. And I just wish the Elder Justice Center well. That's all I have to say. Thank you.
All right, thank you. Thank you, Kathy. So if there are no further comments in reference to this agenda item, we're going to move on. And again, as I indicated earlier, we're going to bring this back on the September board meeting for us to act on a resolution to continue the Elder Justice Center, hopefully in a permanent basis, subject to funding that is secured for the services that we hope to provide. So with that, we don't have anything else under new business. There are no executive session items. Any member of the public wishing to make any comments to the board? There being none, the next board meeting is scheduled for September 28th. That's our fourth Tuesday of the month at 12:30 p.m. And at this point, I will entertain a motion to adjourn.
Move to move to adjourn till September 28th at
I'll
12:30.
second, Your Honor.
It's been moved, seconded. There being no objection, the Board of Directors meeting of the Public Defender Service Corporation is now adjourned. And I want to thank you all for taking the time to weigh in and also to provide comments in reference to this single item that we have discussed on the agenda. Thank you all, and we look forward to seeing you at the next meeting. Thank you.
Thank you.
Good
Goodbye.
day.
Thank you, CJ. Thank you,
Thank
PJ.
you.
Have a good day, everybody.